My name is Niravath. I'm an associate professor at Houston Methodist Hospital. I'm a breast oncologist focusing specifically on survivorship. Genetic testing is done at most doctors' offices. It can be either a tube of blood that they draw, or it can be a saliva sample that they take. Results are usually available in about 4 weeks, and it gives us very valuable information. It would tell us whether or not you have a higher risk of getting cancer in the future. And if so, there are many things that we could do to prevent you from having those types of cancers. So there are many types of patients who may qualify for genetic testing. Many people may be surprised how many can qualify. So for example, anyone who's diagnosed with breast cancer and is 45 years old or younger is going to qualify. Also, if you have certain types of breast cancer. So for example, if you have triple negative breast cancer and you're 60 years old or younger, you would also qualify for genetic testing. And then in the general population, even if you have a strong family history of breast or ovarian cancer, you may also qualify for genetic testing as well. So for example, if you have several relatives who've been diagnosed with breast or ovarian cancer, especially at a young age, you may be an excellent candidate for genetic testing. And then finally, there are certain types of ethnic groups where we see more genetic mutations. So for example, people who have Ashkenazi Jewish inheritance will almost always qualify for genetic testing as well. So now the testing has actually evolved quite a bit. So we typically do a very inclusive panel of genetic testing for patients, meaning that it looks at almost 50 different genes, some of which actually screen for other types of cancer as well. But many of the genes are breast cancer genes, and we're also looking at ovarian cancer, colon cancer, pancreatic cancer. And typically when you have this testing, it'll look for susceptibility for any of these different types of cancers. If, for example, somebody has one parent who has a known genetic mutation and needs to get testing, for most genetic mutations, we only recommend doing that in their mid-20s because that's when the genetic mutation would actually start to increase the risk of cancer for that person. And extra screening and surveillance may be warranted if they were to carry that mutation. And also that tends to be the age where people are more able to understand and rationally act with that information. Obviously, if somebody is too young, they may not be able to handle that information. We typically get the results back in about 4 weeks. Accuracy is actually extremely high. So when we get back those results, we have a very good degree of certainty as to whether or not you carry the mutation. It is actually quite important for people to consider this if they're appropriate candidates for testing, because there is a lot that we can do with the information. It's not just that we know we have a high risk for cancer. If we know that, we can actually do certain things to hopefully prevent that person from getting cancer. So for example, if they have a higher risk of breast cancer, we can perhaps get breast mammograms and MRIs, which are a little bit more sensitive to find cancer earlier. Sometimes there are even medications that a patient can take to reduce their risk of breast cancer by as much as 50%. And then also, in some extreme cases where the risk is extremely high, some women may choose to have prophylactic bilateral mastectomies, which then brings the risk down to almost zero. So each of the genes that carry a certain risk for breast cancer actually have a different risk. So meaning that there are some genes that have a higher risk than others. But no, there's no gene in general that means that you will definitely get breast cancer. But the risk may vary. And depending on your mutation, your doctor would counsel you about what that risk would be. And then consequently, which treatments or prevention strategies may be warranted for that level of risk. So many patients are very worried, rightly so, about privacy. Many patients ask me, well, if I get this testing done and it turns out that I have a mutation, is it possible that I may be discriminated against in some way? There's actually a law to protect people against this. It's called the GINA law. So it typically does not happen that, for example, your employer may know about this. They may never come to know about it, most likely, and they are not allowed to discriminate against you because of this. And similarly, even for things like life insurance, they are not allowed to include those things in their consideration. One other concern that folks sometimes have with genetic testing is that they're a little bit worried about that information, meaning why would I want to know that? But I think it's very important to understand that knowledge is power. By knowing that, there are things that we can do actively to intervene and prevent the otherwise natural course of events from happening. So it is something that we can actually take control of and change your fate that might have otherwise been destined. There's no reason to be fearful of genetic testing, which is something that we come across quite often. I think with genetic testing, it just increases our knowledge about what your risk may be, and then it increases the potential arsenal of tools that we can use to keep you healthy and keep you safe. And that applies not only to you, but also to others in your family. So if you get the testing, it could lead to a cascade of other folks realizing that they may have higher risk, and we could literally be preventing many cancers within the family.